2010, the Health Reinsurance Association, which is our state high-risk pool, which was created in 1975, I think was the first in the country, and there's 30-some. Their future is unclear with all of this, but the point of this slide is to say, it's probably fair to say that Kevin's primary focus and obsession is making sure we get everybody who could benefit from using the exchange, that he's going to talk about in detail, getting them to the exchange. Our other concern is, what about all the other people? Because again, so many people don't even learn about insurance. We've got a state high-risk pool population. It's under 2,000. Those are people who probably, when coverage as of 2014 is not based on health status, would benefit from getting out of the high-risk pool. We've also got Charter Oak. We've got all these people with individual coverage. Tends to be about 5% of the population whose policies are not likely to meet the minimum essential requirements of the Affordable Care Act. And maybe all the insurers will notify them, but it's a very important population to reach. And I'm not going to go through all of these things. I actually have brought a suggested reading list, and if you want us to email it to you, we can do that. I've got an associate's business cards. That way you can just click on the link. But this reading list includes some articles, some books, but also the Access website, the healthcare.gov website, which is the federal website. So there's an awful lot you can get online. But let's just briefly go through some of these changes. The Affordable Care Act created temporary high-risk pools in all 50 states. So that's different from the Health Reinsurance Association. The temporary high-risk pools were subsidized, and you had to be uninsured for 6 months and have a pre-existing condition. All of those are slated to go away December 31st of this year. So that's another population that's going to need coverage. And frankly, I should say that enrollment to them has been closed. Just wanted to comment on the adult children to age 26 being allowed on a parent's plan, regardless of what the right age is. It's just such a wonderful change because it's fair. And we're so happy to be out of the dispute business over, oh, how many units was he taking? He wasn't really eligible for that coverage. It's just horrible. So at least 26 is fair, because before you had to be a full-time student. It got increasingly more stringent to prove you were a full-time student. Ridiculous. So let's just talk in terms of 2011 about insurers being required to meet medical loss ratio targets. So everybody knows what that means. Medical loss ratio is the...
No, I've heard, I don't know what it is.
Right, I want everybody to know this. Medical loss ratio is the percentage of the premium spent on medical care. All right? So the